About 1 out of every 20 people in the United States of America will develop colorectal cancer if they're not undergoing screening.
Early detection in colon cancer and other cancers also is the most important aspect of it that we here at Stamford Hospital try our best to promote, because if you catch anything early enough, you can really be a complete cure and go on with a regular life afterwards.
Early diagnosis is critically important because we know that curability is related to the amount of cancer present at initial presentation. So less is more here, so to speak.
People should get a colonoscopy routinely when they're over 50.
However, there's a group of patients who need to start earlier. People with strong family histories of colorectal cancer may need to start, in some cases, as early as 20 years old.
We have a pledge with the American Cancer Society by 2018 to try to screen up to 80% of the population in the area, which is a great step forward in trying to prevent colon cancer in this community.
If everybody did that, we'd reduce the risk of getting colorectal cancer by about 80 to 85%.
So the technology that's available here at Stamford Hospital in colon cancer screening is actually quite advanced. It's a new technology called Fuse or EndoChoice, where it gives us a much better view of the colon. We have actually 3 cameras on the end of our scope, which allows us to see 330 degrees in the colon, where standard colonoscopes basically only look forward. Or if at a colonoscopy a patient is found to have a colon cancer, the next step would be talking to an oncologist, possibly a general surgeon or a colorectal surgeon, and with a multidisciplinary approach, we can come up with the best plan of attack for the colon cancer, whether it be just chemotherapy, whether it be surgery, whether it be radiation.
A patient with colon cancer back in the 80s had a survival rate that was poor.
The good news on treating colorectal cancer is the surgery part of it has improved, as has the oncologic or the chemotherapy part.
The computers now allow us to just generate combinations of X-ray beams that human beings could not do in the way that radiation treatments used to be designed.
We used to open a person's abdomen and look around, find the cancer, and take it out. Now we can more precisely locate the cancer not only from the colonoscopy that was performed on the patient, but we can also locate the cancer from use of CAT scans. Minimally invasive surgery comes with a robotic form and what's called a laparoscopic form. The robot can be helpful for people with really low rectal cancers. It also allows the surgery to be done in 3D. Stamford Hospital's been a leader in terms of oncology care for a long time. We're usually involved with the care throughout the course of a person's recovery. Emotional support's there too, and just really guiding that patient to whatever they need, sort of individualizing it. I think we need to listen to our patients, and as we listen to our patients, we find more creative ways to make their course of treatment soothing.